Welcome to another episode of MeraDoctor. We would be talking to ENT surgeon Dr. Prashant, and today's topic is deafness. Welcome, Dr. Prashant.
Thank you.
So, can you tell us what is deafness to begin with?
Well, deafness is someone who has hard of hearing. Many of times it is like people will be like, huh, come again. That's the most common thing which anyone can relate to. So deafness is definitely one of the most ignored handicap.
Okay.
It's something which is much more worse than blindness, but no one is talking about it because it doesn't hinder their life to that extent as blindness.
So, I think that brings us to another important question. What are the different types of deafness? I'm sure there are different types, because of which certain types are ignored and certain are not. Because I'm sure somebody who can't hear completely is not definitely going to ignore it. So, can you tell us more about it?
So there are two different types of deafnesses. The hearing, if it is associated with so let me put it this way. The ear is divided into three segments: the external ear, the middle ear, and the inner ear. So the inner ear is where the nerve of the hearing is there, and if that is affected, that is called sensorineural hearing loss. Okay. And if the middle ear is affected, middle ear or the external ear is affected, wherein the sound getting transmitted is not conducted to the nerve. If there's a mismatch in that is called conductive hearing loss.
Okay.
So basically there are two types of deafness: sensorineural deafness and conductive deafness.
Can you tell us more about sensory neural deafness?
So sensorineural deafness is one of the most common kind of deafness which everyone would encounter. This is usually associated with aging. Okay. Most common cause for deafness is aging. So as you age, as you might have noticed that many people wear glasses, many people will have cataracts, many people will have other issues with vision. The same thing affects the hearing also. The nerves get degenerated, and it will be more with diabetes. Okay. When a patient has diabetes, the nerves get affected much more faster, and it will worsen much more faster.
So that would definitely mean that somebody who has diabetes already, or who's suffering with that, should take extra care to get their ears checked up more frequently.
Yes. Ideally, every 6 months to 1 year, people need to get their hearing testing done, which is usually ignored. People just take their blood tests and they'll tell, okay, I'm good. But that doesn't mean they're all good with the hearing also. So hearing testing also needs to be done, repeated every yearly.
Like we do have different age groups, the frequency of eye test is also different. Is it similar with hearing as well, or ear tests as well?
Yes, up to the age of 30 to 40, once in 2 years or 3 years is okay. Beyond 40, every year would be better, and if a person is using a hearing aid, every 6 months is better.
Okay. And what about so you're saying after 40, at least once a year they have to visit a doctor?
Yes.
You also said that some cases we need to go in every 6 months. If they're not wearing a hearing aid, let's say, when do we actually go in for a test every 6 months?
So if a patient has any other issues like diabetes or hypertension, that can definitely cause more amount of worsening. So for them, every 6 months is recommended. Or patients who are or people who are more than 60 years of age, every 6 months is better.
Okay. So you said there are two types of hearing issues. One is something related to the nerves. The other one is external, middle or the external. Can you tell us more about it?
So the conductive hearing loss is when the conductive mechanism. So you know that the three smallest bones of the body is inside the ear. So if the bones are affected, or if the eardrum is affected, so in secondary to which the transmission of the sound is affected, so then it's called conductive hearing loss. So usually the conductive hearing loss can be corrected surgically.
Okay.
So hearing aid usually will not help them because the conductive mechanism is affected. So for them, surgical intervention will prevent deafness.
Or which will help
them cure deafness.
Okay. So you're saying if it is conductive, issues, can it be resolved completely by surgery, or is there an age limit or certain criteria?
In conductive deafness, if it's a pure conductive deafness, then 100% of its symptoms will be resolved with surgery. If it is got a neural component involved, then the surgery will help improve the hearing, but not to the fullest.
Okay.
So till what level the hearing nerve is involved, till that level it will get it up.
So I think when we talk about aged patients, you could probably fix the conductive hearing, but the neural is something which we can't do.
Yes,
so
exactly.
That is a scenario.
Yes.
Okay. And so hearing aids, do they help with the conductive also, or it's always only the neural?
When there is a conductive component, what does hearing aid do? The basic mechanism is it amplifies the sound and it will transmit it more louder into the inner ear. So it's like we are placing a loudspeaker inside the ear to ensure that they can hear louder.
Mm-hmm.
So when the sound is loud, it will obviously go
Reach
to the nerves. But if there is a gap in the conduction, so the conduction of the sound will be limited.
Okay.
So it doesn't fully help them, but it does help them in a particular or to certain extent.
Okay. So if I'm understanding it right, doctor, we're saying that hearing aids will be more helpful in terms of these neural deafness cases rather than the conductive deafness cases.
Exactly.
Although there could be chances that even with the conductive deafness cases, there would be some improvement, but not really a full-fledged result.
Improvement. Exactly.
Okay. And when we talk about hearing loss, is there you mentioned that with age it's definitely a component, right? But do you notice that there is a trend where a certain type of behavior, a certain type of field of work in which people are prone to deafness more than just the age?
Yeah, definitely. People who are working in noisy environments are very much prone to developing hearing loss.
Mm-hmm.
Especially people who are working in factories, which are especially in the boiler rooms or in the cement factory, or where there is a lot of hammering or any kind of a manufacturing which causes a lot of noise. Or in IT department in server rooms, or any place which has high amount of vibrations or sound producing, they are more prone for developing hearing loss.
Okay, and now the trend of listening to music is completely different from what it was few years ago. I think few years ago, or many years ago, it was just the radio and the television. Then there was a lot of these home theaters and all that. Now the home theater is built into the ear itself, right? People actually use headphones more frequently now than few years ago. Do you see that impacting the patients who are coming to you? Do you see a different trend as such with that?
Yes, definitely. Nowadays, I am seeing more and more youngsters who are developing hearing losses or sensory hearing loss secondary to excessive use of earphones. Because you use an earphone, you tend to max up the volume because you want to cut off the external noises, and that in fact is a very harmful thing to do. That is affecting the hearing of all the kids, all the adolescents and every young adults. So I'm seeing a lot of deafness in such a age group.
So it's not just the age which is affecting it. I think it's the new generation who's also getting impacted because of the lifestyle.
Yes.
So deafness is now even a lifestyle illness, you can say. Right?
Yes.
Earlier,
Yeah.
I think it was more called age-related illness. Now it's more lifestyle illness. But do you see the cases increasing in the near future? Because a lot of these companies are coming up with noise cancellation and other mechanisms to actually try and help out. Does that help the people, or do you see any efforts being made there?
I can't say that people are going to buy noise cancellation earphones because it's very, very expensive. So if people do tend to use noise cancellation earphones and they do reduce the volume, then definitely it might be reducing the impact on the hearing.
Okay. So, doctor, we spoke about neural deafness, right? And these two being the primary cause, where it's a lot of exposure to noise and illnesses like age-related illness, or it could also be diabetes or lifestyle issues, right? What are some of the common causes for conductive deafness?
So, conductive deafness, the most common issue or the most common cause is nothing but just your earwax. People have this constant myth that using a earbud will actually clean the ear. Well, in fact, it is actually pushing the wax and the debris further deeper inside, and it's worsening the cause. So the earbuds are not designed to get the wax out, it's designed to push the wax in. Okay. And instead of cleaning it, you're further pushing the debris inside, and that causes a barrier for the sound to hit the eardrum. That is the most common cause for a conductive hearing loss.
Okay. So is it, I think I can talk about so many instances when I've seen people put in not just earbuds, they use keys and they use all different things to actually try and take the wax out or scratch their ears and all that. So all these will have adverse effects.
Yes. In fact, the human body is designed in such a way that it self-cleans the wax.
Okay.
So you might ask why or how. So your joint is here, which you use for talking, for chewing and everything. So this joint vibrates the ear canal, and any debris which is inside will come out naturally. Okay. Because the eardrum is at the end of the ear canal. So nothing can go beyond the eardrum until unless there's a hole in the eardrum. So because of the vibrations, it will push out all the debris by itself, and it's self-cleaning. So it doesn't require any kind of a cleaning.
Okay. So many people actually have this habit of using earbuds to remove excess water after taking a bath, probably even oiling themselves a lot and all that. So even that is not really required.
Not required. The ear is designed in such a way that it doesn't allow water to enter the ear until unless you actually forcefully pour water into the ear.
Okay. Okay. So taking a shower
it doesn't
will not affect. But what about a swim or something like that? Are there some things we can do to ensure it doesn't enter, or if water enters, is there any side effects or bad effects?
So when water enters the ear, only thing which you can do is to just wriggle your ear, and because of the wriggling, it will come out by itself.
Okay.
If at all the water stays back for longer duration, you can consult a ENT surgeon so that they can suction it out.
Okay.
Because water staying back in the ear canal at times can lead to infections.
Okay. So only in cases of people going into swim and probably strolling out in the beach or in the rivers and all that, that's when they are exposed to so much water that can actually enter. Otherwise a normal shower shouldn't really push in so much water inside.
Even while swimming, it usually doesn't enter. Very rarely does it enter. So in order to prevent water entering the ear, if you are very concerned, you can use earplugs before you jump into the water.
But otherwise, is it normal for a little bit of water to enter and dry on its own? Is that something natural? Or if the water enters, should we really be concerned?
If the water enters, you will know it has entered. Mm-hmm. So at that time, you need to wriggle and take it out.
That's it.
That's it.
All right. So what are some of the common care or you can say ear care that we can actually try at home or do at home? We're not supposed to use earbuds as something which is very clear, but what are some things we could do?
Something, just eat normally, talk normally, chew normally, your ear canals will be taken care by itself.
Okay, actually we don't have to do anything.
Nothing.
Nature is designed us in such a way that it'll actually take care of itself.
Exactly.
So there's nothing to prevent all these things, right? I mean, prevent is avoid noise, get your ears checked regularly. Other than that, just eat healthy and stay healthy. That's it.
That's it.
All right. Okay, doctor. And when we talk about deafness, there are certain people who develop deafness at a very young age, right? Hearing aids, how helpful is it?
Hearing aids are definitely useful for people who have deafness, because if you don't use hearing aids, the hair cells or the inner ear cells don't function normally, because if they don't get correct stimulus, then it leads to further loss of hearing, and those losses will further worsen the deafness.
I think we have covered a lot of information in deafness, and when we talk about specifically anything to do with noise pollution, we've got another episode where you can actually hear more about noise pollution and how we can prevent it or take care of it. And thank you, Doctor, again to talk about deafness, and we would be meeting soon and talking more about health and fitness. Thank you.
Thank you.